वेलकम बैक टू मेडिकोपॉइंट। आज हम देखेंगे प्रैक्टिस ऑफ मेडिसिन पेपर 2 के PYQ क्वेश्चंस। चलिए स्टार्ट करते हैं 20 मार्क क्वेश्चन से। फर्स्ट, स्ट्रोक विथ होम्योपैथिक एक्यूट प्रिस्क्रिप्शन, देन डेंगू, इन्फेक्टिव एंडोकार्डाइटिस, हाइपरटेंशन, एंटेरिक फीवर, माइग्रेन, एपिलेप्सिया, aortic regurgitation, hypopituitarism, mitral stenosis, then migraine, diabetes mellitus, atrial septal defect, rheumatoid arthritis, diabetes insipidus, subarachnoid hemorrhages, diabetes mellitus, mitral stenosis, epilepsy, myocardial infarction, dwarfism, epilepsy, angina pectoris, Addison's disease, coma, mitral valve disease, and hyperthyroidism. Let's move toward 10 mark questions. Renal calculi, causes and clinical feature of gonorrhea, complication of obesity, plus indication of phytolacca, clinical feature and indication of baptisia in enteric fever, management of obesity, iron deficiency anemia, malaria, psoriasis, indication of sorinum, diphtheria, indication of 2 homeopathic remedies, eczema, marasmus, iron deficiency anemia with miasmatic understanding, sickle cell anemia, homeopathic management, filariasis, renal calculi, eczema, acute glomerular nephritis, bacterial meningitis, thalassemia, acute renal failure, lichen-plansen with sulfur and nightmare, poliomyelitis, idiopathic thrombocytopenic purpura with lachesis and phosphorus. Then gonorrhea with medorinum and nitric acid, cholera with veratrum album and camphora. Beriberi, its causation, feature, calcarea car with rustox, iron deficiency anemia, leprosy, aplastic anemia, secondary syphilis, nephrotic syndrome, anemia with Sina and ferromate, acute glomerular nephritis, measles with gelsenium and ferromate. Let's move toward the 5 mark question number 2. It includes causes of bradycardia, investigation of rheumatoid arthritis, marasmus, OCD, clinical feature of beriberi, clinical feature of hemiplegia, causes of tachycardia, investigation of renal calculi, clinical feature of schizophrenia, types of alopecia, pellagra, its causes and clinical feature, nocturnal eneriasis with clinical presentation, hypertrophic cardiomyopathy, neurological causes of bladder dysfunction, genital herpes simplex, gout, its causes and clinical feature, anorexia nervosa, senile dementia, myasthenia gravis, tetralogy of Fallot, mood disorder, scabies, forced bite, measles, migraine, its type and feature, xerophthalmia, urticaria, phobia, complication of low birth weight, differential diagnosis of hematuria. Then it includes Glasgow Coma Scale, pemphigus, aspexial neonatal, incontinence of urine, its causes and feature, schizophrenia with clinical feature, beriberi, causes of acute renal failure, anxiety disorder, clinical feature, disorder of pigmentation with clinical feature, angina pectoris with clinical feature, infantile diarrhea and its causes, psoriatic arthritis, ichthyosis, marasmus versus Kwashiorkor, its define and differentiate, cardiogenic shock, Parkinson's disease with clinical feature, mania, tetralogy of Fallot with features and investigation, syncope, psoriatic arthritis, beriberi, depression. 5 mark question of question number 3. It includes Caesareum in DM, L serum in chronic renal failure, Calphos in ankylosing spondylitis, Sina in pica in children, Platina in personality disorder, urticarians in urticaria, Lycopodium in acute renal failure, Euphorium in dengue fever, Chelidonium in neonatal jaundice, Iodium in hypothyroidism, Natrum sulf in osteoarthritis, Petroleum in dermatitis, Adrenaline in Addison's disease, Lidum in osteoarthritis, Calcarea carb in delayed milestone, Platina in hysteria, Sarsaparilla in renal calculi, Camphora in cholera, nitric acid in UTI, Euphorium in fever, urticarians in urticaria, Abrotanum in marasmus, colocynth in infantile colic, aconite in anxiety, carbovage in cyanotic spells, fluoric acid in keloid, belladonna in mania, apis male in nephrotic syndrome, baryta carb in hypothyroidism, silicea in mumps. Then it's include mesothelium in eczema, cinnamon in malaria, platina in hysteria, calphos in rickets, abrotanum in marasmus, causticum in urinary retention, phosphoric acid in diabetes mellitus, mesothelium in herpes zoster, colchicum in goat, syphilinum, obsessive compulsive disorder, Berberis vulgaris in renal calculi, calphos in osteomalacia, belladonna in measles, baryta carb in senile dementia, muriatic acid in scurvy, lithium carb in goat, cantharis in UTI, ignatia in hypothyroidism, cretinism in baryta carb, renal stone disease with Berberis vulgaris, typhoid fever in Bacteria tinctura, eczema in anacardium, diarrhea in children with chamomilla, mania in stramonium. Let's move toward the most repeated question, don't miss it. It includes diabetes mellitus, hypertension, migraine, epilepsy and mitral stenosis. These are the most repeated questions. High yield system, maximum mark coverage, it includes cardiac disorder, all nervous system disorder, endocrine and metabolic disorder, infectious disease and musculoskeletal and autoimmune disease. If you found this video useful, then like, share and subscribe to Medicopoint and join our Telegram channel for more information and notes.